let's get started with the first focus area. Let me introduce to you Jennifer McCarty. She's the Director of Clinical Services Project Management, and she's going to cover focus area number 1 and focus area number 2. Jennifer, the floor is yours.
Good evening, everyone. So focus area 1 and number 2 are related. So I'll give you a little bit of an overview and then talk on each point specifically. So focus area 1 looks at law enforcement and first responder crisis intervention team mental health response training. And for the crisis intervention team program, I'll give an overview so you have a little bit of a concept of what these two focus areas are aligning with when we're talking about this program. So the crisis intervention team, or CIT program, is a community partnership of law enforcement, behavioral health professionals, community health providers, social service agencies, and people impacted by mental illness and their advocates. It's really an innovative first responder model of police-based crisis intervention training to help persons with mental disorders or addictions access treatment rather than place them in the criminal justice system due to illness-related behaviors. The training promotes officer safety and the safety of the person in crisis so that everyone leaves the situation as safely as possible. And the CIT program in Genesee County is currently in the planning stages. So where we're at now is we've received funding through a federal SAMHSA grant to partially fund the community planning, as well as fund the initial hiring of a CIT coordinator that will serve the whole county. And this is something that no traditional funding sources exist to continue to fully fund these efforts beyond the grant period, which will end in April of 2022. So we don't want people with mental health needs who don't need to go to jail because there's no other option. Millage funding would allow for the CIT program implementation to be fully funded and sustain the program following the best practice model. A CIT coordinator would be available for Genesee County to ensure regular ongoing training opportunities are available for law enforcement and first responders. This does also include 911 dispatch and jail personnel, as well as regular communication between all necessary community partners. And additionally, this would ease the financial burden off the local budgets that can be impacted by sending law enforcement officers, first responders, dispatch, jail staff to a 40-hour training and subsequent booster trainings with the goal to have a CIT trained officer on every shift. So let's move on to focus area number 2, very related, law enforcement and mental health co-response and jail diversion. So currently, those suffering from mental health challenges face either they're going to an emergency room or the local jail when they come into contact with law enforcement due to any behavioral health related issues or symptoms they might be experiencing. There's really limited behavioral health options out in the field 24 hours a day. As we know, emergencies happen 365 days a year, and the millage would allow us to provide jail diversion and emergency room diversion with co-responding mental health professionals to allow for that 24-hour, 7-day-a-week, 365 days a year of consultation and support to both officers and people interacting with law enforcement who may be experiencing mental health crisis or some sort of behavioral health symptoms. So crisis de-escalation would really be the key goal to allow for a safe outcome for everyone, with linking to treatment as the end goal. And as I mentioned under the focus area number 1, the funding for this does end in April of 2022. So with the millage, we would be able to continue to fully fund this effort. Thank you.
Thank you, Jennifer. Appreciate that. Next up, I'd like to introduce to you Jennifer Kimmel. She's the supervisor of the Assisted Outpatient Treatment Program to discuss focus area number 3.
Hello, everybody. I am here to talk about focus area number 3. And what we have right now is GHS has an established collaborative relationship with Genesee County courts that works to provide services to individuals through either mental health court or the Assisted Outpatient Treatment Program. First, I'll talk about Assisted Outpatient Treatment Program. The Assisted Outpatient Treatment Program, or AOT program, is a collection of services for people on AOT orders or in need of an AOT order. This program is brand new. We just started on November 30th, and we're funded by a SAMHSA grant. We help identify when someone has met a strict legal criteria of a person requiring treatment, and we assist in obtaining a civil commitment court order mandating that individual to outpatient mental health services. Once someone is on an AOT order, we help them connect to needed services and monitor their compliance with their court order. In addition, some individuals are seen by AOT case managers at least weekly and have regularly scheduled hearings with the probate judge to discuss the progress on their mental health goals. Currently, GHS's AOT program is monitoring just over 300 cases, and a number of studies have shown that AOT orders and having an established AOT program improves compliance with outpatient treatment, which in turn reduces psychiatric hospital admissions, crisis services, criminal justice involvement, and other potentially tragic consequences. Mental health court is a separate program that identifies individuals who have committed a crime during a time in their life that they were not psychiatrically stable. It's a court supervised treatment program for individuals with severe and persistent mental illness. Individuals who meet the admission criteria are given a chance to participate in mental health court instead of criminal proceedings. Individuals in mental health court must be involved in intensive outpatient mental health services, volunteer, work, or be in school and stay sober. And they're in the program anywhere from 12 to 18 months. During that time, criminal justice staff and mental health staff collaboratively monitor the individual's compliance and provide individualized incentives and sanctions. And they'll modify treatment as necessary to promote public safety and the individual's recovery. In Genesee County, we have successfully graduated just over 325 people, and the majority of these individuals have never been seen by the criminal justice system again. In Michigan, our mental health court graduates have had the following positive outcomes. They've improved their employment status, they improved their educational level, improved their quality of life, their mental health, and they are more compliant with medications. Currently, both the AOT program and mental health court are grant-funded programs. This millage would allow for both of these programs to continue to be in existence after the grant funding period ends. Much of the help we provide in these programs is not able to be billed to insurances. And additionally, it will allow us to further expand services to provide opportunities for participation in mental health services for individuals that are uninsured or underinsured to ensure that they receive adequate mental health treatment services that reflects the severity of their mental illness. The money spent on funding these programs will overall save costs associated with an individual with severe mental illness, and will reduce the incidence of negative impacts on the community and will assist with pro-social integration into the community.
Great, thank you, Jennifer. Appreciate that.